please welcome my guest, nurse practitioner Elizabeth DeSandre. Elizabeth, thank you so much for coming today. I know how busy you are, and I know you've recently started a new position, so I'm so happy that you're here to tell us about that. But before we do that, I want to introduce you to the community, so tell us a little bit about your background.
Okay, well, I've been with Novant now for 7 years. I started as a registered nurse in labor and delivery, and I've enjoyed that, and I'm happy that I've transitioned to a nurse practitioner role.
That's awesome. Tell me, where did you go to school? Are you a local girl?
I am a local girl, yes. I'm born and raised right here in Brunswick County. I grew up on Oak Island, yeah. So I started my nursing, I got my associates at Brunswick Community College.
Nice.
Yeah. And then I decided pretty quickly that I wanted to continue my education, so I got both my bachelor's and my master's at the University of North Carolina at Wilmington.
Oh, so you did grow up here, and where'd you go to high school?
I went to South Brunswick High School.
South Brunswick? Yeah. So tell me about your practice, your current practice, and then we'll talk a little bit about your providers, but
Sure.
Where are you working right now?
Right now our main office is in Bolivia, Novant Health Urology Partners. I've started in June, so fairly new. I work alongside Dr. Lydia Lebachetta and Dr. Stephen Robbins.
Yeah, they're great providers. We've had them on the show before, and I always enjoy having them. So I know that you see patients in Bolivia, but you have offices located elsewhere, correct?
We do, yes. We have several different satellite offices, so we also see patients in Southport, Carolina Shores, and Leland.
And are you primarily located at the office here in Bolivia, or do you have to go to the
We
others?
all switch up.
You all
There's
switch
different
up?
days, yeah. We move around so that everybody gets the opportunity to see whomever they want.
Well, I know that you recently opened a new office at Brunswick Forest.
That's correct, yeah.
I think it was at Waterford, was it at Waterford before, and it's recently moved down to Brunswick Forest. How's that working?
It's really good. I mean, it's fairly new. Like once I started, that
Right.
kind of happened all at once. But
Yeah, it was a quick.
yeah, no, it's really nice. The office is beautiful. It's large. I think it's going to be a great asset to the patients in the Leland area.
Yeah, and that's a huge community. Brunswick Forest is just growing by leaps and bounds, and so it's so convenient. It's right there.
Yeah, it is.
So I think that, and there's lots of great places to eat and shop. And so
Yes.
are there specific days that they're at Brunswick Forest?
Yes, right now we're there Monday all day 8 to 5, and then on Fridays we're there half a day 8 to 12. We are trying to increase some availability down there, so you should in the near future see us there on Tuesdays.
Oh, that would be great.
Yeah.
So that's every week, Monday and Friday, and then.
Yeah.
I'm curious. I know you were in labor and delivery, and to me that would be the perfect space to be. You know, the babies are so much fun.
It is.
So, what drew you to urology?
That's a good question. We have this running joke. I didn't choose the urology life chose me. My last semester in school, we got to choose a specialty rotation, and I kind of wanted to step out of my comfort zone and try something different. I met up with Dr. Lebachetta, and she decided, hey, come on board, I'll be your preceptor. And so she showed me the ropes as a student, and I just fell in love with it. You could feel her passion for her specialty.
Yeah, she does have.
Yeah, so it felt like a good fit.
Yeah, and she's so much fun.
Yeah, she is.
She's a hoot, and to work with her would be a privilege,
Yeah.
I think.
Yeah, both her and Dr. Robbins are great teachers.
Yeah, Dr. Robbins is so mild-mannered and just so, he never gets upset.
Never.
It's a great practice. I think it's great. Do you have a specific area or focus in urology that you really like to read about, or?
You know, I'm still learning so much myself, but I see a whole bunch of recurring urinary tract infections. So I'm reading up on that. I'm treating a lot of patients with that.
That's so common.
Yeah, it's so common. I'm also seeing overactive bladder, urinary
yeah.
incontinence, both men and women, erectile dysfunction, enlarged prostates. So we see so much of everything, and it's fascinating how much urology has to offer.
That's true. It can cause a whole bunch of different problems.
Yeah.
Well, I know that this month, September, is Prostate Cancer Awareness Month. And I believe it's the second most common cause of cancer in men, second to skin cancer. So for those watching, can you talk about some of the signs or symptoms of prostate cancer?
Sure. Well, interestingly enough, there's not really any signs or symptoms. So that's one of those things where you really have to stay on top of your health care and get screening exams. And for this one, you would get some blood work. It's called PSA. And from there, we would adjust your treatment plan and follow forward if we needed to.
That's good information. I know that for urology in particular, sometimes patients are a little shy about seeing certain kinds of doctors, and I think urology is one of them. I imagine you spend a lot of time trying to make patients feel comfortable. Do you ever find that because you're a female, that's an issue with a male patient, or vice versa?
Yeah, I do think, I mean, different patients have different preferences, and you have to respect that. You know, the fortunate thing is that we have both a male and female provider, so they can have their pick. You know, my job, whether they're comfortable or not, is to give them the best care possible. I'm going to maintain professionalism. I'm going to, you know, make them as comfortable as I can be, because coming to see us for their concerns is a private and intimate matter. So to let them know that their information is going to be confidential and private, it's very important.
It is very important. I'm glad to hear you say that. Do you encourage patients to speak up about their concerns to you? I mean, if they're being hesitant, do you have?
Yeah, I mean, you can kind of read people and see, you know, if something else is bothering them, and I know how to kind of approach people like that and kind of ask certain questions that might gear us towards a different conversation.
That's good. I'm so glad that you found urology. You seem to be very, very interested in it, and I'm glad that you're able to work with Dr. Labachetta. I know that you and I met earlier this year at the vaccine clinic when we were working at Brunswick Community College, and I so enjoyed working with you, and you were very willing to come and spend time in the rain and the snow and the this and the that. It was not good. Tell me a little bit how that felt for you. Did you enjoy that?
I did. It was very empowering. You know, I told you I'm from this area, so to give back to the community and be able to see hope in people's faces, I mean, it's just a wonderful experience to have.
I don't know about you, but I saw a lot of my friends and just acquaintances in there. Was that true for you too?
Yeah, I saw a lot of people, and a lot of people I didn't know, which was fine too. There were so many people, the numbers and the amount. It was a very well-run machine. The amount of cars, wait 15 minutes and go. I mean, huge numbers.
Get that shot in the arm and get out of here. But they were also thankful.
They were.
They were so appreciative. And how about all the cookies and all the candy that was brought in?
I have to learn how to say no.
And it was so cold and so rainy some of those days.
Yeah, we could have used hand warmers instead of all those cookies.
Yeah, well, you're right about that. But, well, we appreciated your time that you spent there with us. It was very helpful. There were days when we were trying to pull people out of the woodwork to work, and so it was amazing that we had the turnout that we did. But anyway, thank you so much for coming on today. It's been a pleasure to get to know you, this side of you, outside of COVID vaccine. And I hope you'll come back and visit us soon.
Absolutely.
All right. Thank you so much.
You're welcome.